Now it's on to Dr. Christina Karamanidou, sorry. And Christina is graced us, will provide us with Navigating the Emotional Landscape Advocacy for Psychological Resilience in Cancer Care. Very much looking forward to this. Thank you. That was good too, Ben.
I can't see my slides. Yeah.
We have slides coming for Christina. Is that it? There you go.
Thank you. Hello, everyone. Thank you for coming. Thank you for the invitation. It's great to be here today. We are going to talk about navigating the emotional landscape, advocacy for psychological resilience. So essentially, we're going to talk about what is very commonly left out of the cancer experience, the emotional journey. And we do realize cancer is a physical illness. However, it can be a deeply psychological experience as well. And this is what we're gonna look at today. Your role as advocates in how you can support people to be heard and to be empowered. So why does emotional well-being matter? I can argue that emotional well-being is as important as physical care, but obviously I am biased since I am a psychologist. But we know from the literature and also from lived experience that distress can impact treatment decisions. It can also impact treatment adherence and also quality of life of patients. And patients are not alone in this. Actually, carers also carry a large emotional burden, which is sometimes silent completely. Obviously, the cancer trajectory is not a straight line, and I have an analogy here, a metaphor, that maybe will resonate with some of you. It's the emotional seasons of cancer. So each season has got an emotional atmosphere, let's say, and you can see that diagnosis could look like winter. It's very bleak, it's very uncertain, everything is bare. But then treatment comes, and this is spring. There is growth, but sometimes it's still unpredictable. Everything is still unpredictable. Summer can give some relief, but there is still danger of thunderstorms, and this is monitoring or remission. And finally, autumn. Autumn is gives way to grief, but also preparing for a change. So I think a key message here is to just let patients know that every season will come in its own time. Everything will change, and all seasons will pass. Giving way to some real voices. These are completely powerful and often do not find their way into the medical journals, into the medical files, but they can surely see how these experiences can change the whole of the cancer trajectory, the whole of the cancer experience trajectory. So how do we recognize distress? How can we recognize distress in an individual? Obviously, the distress is not just about tears. It can be being silent, being withdrawn, being irritable, or just being different to one's normal self. Patients have actually expressed hopelessness, and carers, on the other hand, have expressed guilt. They sometimes are overwhelmed. The main point that we need to make here is that distress is contagious. So the emotional state of one member in the family can actually influence another member. And before you know it, the emotional states ripple through the family. Why do advocates matter in this picture, in this context? Why do advocates matter? You are the first ones to notice emotional shifts because you talk to patients a lot, and a lot of different patients. You can provide a safe, non-judgmental space, and you can be the bridge between patients, carers, and healthcare teams. Not taking the place of healthcare professionals, but actually advancing the circle of care, extending the circle of care. So how do you recognize distress in practice? It's really easy. It's the 3 R's framework. Here it is. The first is recognize. So looking for signals, and the signals can just be silence, irritability, loss of spark. It can be change of habits. Also, bear in mind that some things are not said. Look for emotional words. Try to understand what they mean. Respond, as Ben Kennedy and Jennifer in the previous session talked about, compassionate listening, active listening, but with compassion, validation of feeling, and small supportive acts can really go a long way. Last but not least, refer. Have your referral pathways at hand. See where your own support and help can reach, and when it's time to call in for professional help. Building psychological resilience is sort of an antidote to all this, is an antidote to distress. And we have to highlight at this point that resilience is not a character trait, it's not a personality trait. It's actually a muscle, and it can be exercised and flexed. And resilience is not about being strong, but it's about adapting, coping, and finding meaning in the face of adversity. So this is what we are trying to help patients and carers do. There are protective factors, of course, support networks, good information, routines, and self-care, which can be utilized. But we also need to have in mind that carers and patients build resilience together. It's not something they can do alone. What did I mean by small and meaningful acts? Very quick tips that you can use every day. Checking in. How are you really? Validating. Normalizing emotions. Saying it's normal that people in this situation might feel. Offer practical help, and the practical help can be offering information or sitting with someone or just connecting them to resources. And with carers, helping them allow breaks for themselves, because this can generate a lot of guilt for carers. Compassion matters because it actually impacts on 4 completely different levels. The first one is the biological level, so it can calm the body. The validation can lower hormones, stress hormones, and can relieve tension. It can also have an impact on the psychological level because it can open the mind. If someone feels heard, they can they can reduce their fear, they can make clearer decisions. It can strengthen connection, which means it has an impact on a relational level as well. And finally, it can create what we call the ripple effects, which is an impact on a systemic level. So compassion shown to one person can spread to family or even healthcare teams. The do's and don'ts of compassionate communication. This, I'm sure you have heard it today a lot, And also intuitively you might know all these things, but I just have to mention that in the do's, listen actively, validate emotions, and use open questions. This is pretty easy. The don'ts are a bit more complex. Don't minimize. Don't say, don't worry, it will all be fine. Don't rush to solutions. The instinct that anybody has when they are presented with a problem, especially in this context, is to rush with a fix. This is not actually the correct way to do it. You have to listen first. And don't compare experiences. The same experience can be lived and experienced differently by every one person. So what are some of the practical tools we can use? Have a distress signal checklist, which means look for changes in appetite, in mood, in sleep, and check for red flags. Red flags can be what we talked about just before, withdrawal, irritability, saying I'm fine, which is obviously cryptic. Have conversation starters at hand, like I noticed you seemed quite quiet lately. How are you really feeling? And have your referral pathways near you. Try to understand when is the time to suggest professional support so you don't have to carry everything by yourself. Some key takeaways from this are that emotional care is as vital as the physical care. Advocates are in a unique position because they can spot distress early and they can step in early. Compassionate small actions can really build resilience in people, and that both patients and carers benefit from emotional support. Of course, you are in a much better position than myself to know where resources are and where support can be sought, depending on where you are on the planet. But have in mind that different stakeholders can actually offer different things from where they are. So it might be a local network, it might be a global network, or even a professional organization. Have in mind the ripple effect of advocacy. So every act of compassion is really an act of resilience. What people can receive as compassion, they will experience and they will pay it forward, let's say. So if you have 5 minutes with someone, ask an open question. What feels heaviest today? Reflect and normalize in one sentence. Offer one choice, either talk, information, or sit quietly. One practical step, and book a follow-up. Try to avoid some common traps. Over-reassurance, advice avalanche, letting red flags sit unescalated, and taking things home with you. Because, of course, advocacy needs self-care. It is a core responsibility of everyone that deals with patients to self-care. If you're in doubt, do a safe check-in. So pause before you carry emotions home. Acknowledge what was hardest for you in the conversation. Find one support for yourself, a peer, a supervisor, or even a ritual that you tend to do after a difficult day, and engage in renewal. Find something enjoyable and restorative for you to do, for yourself to do, because this is the only way to sustain advocacy. Thank you very much.